All right. I see we're at 27. I think that's probably critical mass. So we'll go ahead and get started. Welcome everyone to our iSpan Health Equity Training. We are so excited to be here with you all to have a very important conversation that we hope will lay the foundation for the work that you all are embarking on for the SPAN project. And so my name is Janice Goff. I'm the Senior Program Manager in our Center for Community Capacity Development at IPHI. And there will be opportunities for my colleagues to introduce themselves as well. I'm going to go ahead and pass it over to Sarah to do the first set of introductions for her team.
Great, thank you, Janice. Go on to the next slide. Welcome, everyone. We're happy you're all here. A quick recap of the SPAN team. So our SPAN team is led really by our co-principal investigators that generally guide the direction of the program. So that is Janice Simon, who's the center director here at the Illinois Public Health Institute, and Dr. Lisa Massinter, another co-PI, Deputy Director of the Office of Women's Health at the Illinois Department of Public Health. Next slide. The SPAN team, you can see the team members here. So I'm Sarah Flores. I'm the Program Manager of SPAN Overall Administration. And then we have Catherine Birdstein, who is overseeing nutrition policy, Martha Margaret Cotton, the breastfeeding coordinator, Trevor Johnson, nutrition coordinator, Elise Ramos, program associate, Kiara Jones, the built environment and early care and education coordinator, and Sweet P. Bailey, the communications manager. And then lastly, we have an evaluation team that is leading those efforts for the program. That is led by Dr. Jamie Shrieky at the University of Illinois, Chicago, and her colleagues, Julian Lader and Rebecca Schirmbeck, who are evaluation specialists. All right, so a little bit on the purpose of the training. So the health equity focus that brings us here together today, why? So we'll get into this much more in the training, but health equity broadly can be characterized as an action to ensure that all population groups living in an area have access to resources that promote and protect health. And there are population level factors, such as opportunities for physical activity, the built environment, social, policy environments that have a greater impact on those health outcomes, more than individual level factors. So through SPAN, we're working at the state, regional, and local levels to achieve health equity, which means changing systems and policies that have resulted in the generational injustices that give rise to health disparities. So to move the needle on all this, all of our SPAN activities should be grounded in health equity approaches with an aim to reduce health disparities and address social conditions and other factors that influence health. So the purpose of this training overall is to move us toward a common understanding of what health equity is and provide training and guidance on health equity approaches to inform your thinking and planning as you move into your year one assessment and input gathering activities, which in turn are going to inform your planning and implementation of the SPAN strategy work in the years ahead. With that overall snapshot, I'm now going to turn it to our CCCD team to introduce themselves.
Thank you so much, Sarah, for that overview. So as I mentioned, my name is Janice Goff, and I'm going to pass it over to Lori, who is co-facilitating with me today.
Good afternoon, everyone. Lori Call. I'm the director for the Center for Community Capacity Development. Happy to be here with you today, and I use she, her pronouns. Thank you.
Thank you. And Samantha, who is helping with our behind the scenes work today.
Hi, good morning, all. I use she, her pronouns. So my name is Samantha Lasky, and I'm a program manager with the Illinois Public Health Institute. If you're having any tech issues or anything like that, feel free to message me in the chat and I can support you.
Thank you so much, Samantha. And we also have Jess Lynch and Adrian Blasi, who also helped us prepare for today's training, though they are probably not joining us today, but keep them in your thoughts as we move forward. So for today's learning objectives, we have defined equity as a process and an outcome. We're going to describe 2 frameworks to help us really think and visualize how we integrate equity into all areas of our work using the Bar-High model and the MAP equity action spectrum. We then are going to move into identifying ways to advance along the spectrum of community engagement, and we have a cool visual for that. And then we're going to go through the 7 practices of the MAP power framework for the remainder of the training. And then I know our CPPPI team also has some overview at the end over the tools that you all will be using of the project. So we are wrapping up our training, a welcome and training overview now. Thank you all so much for introducing yourselves in the chat. Welcome. Again, we'll start off with equity as a process and then go through all 7 practices, and then we'll have a wrap up at the end. There'll also be a short evaluation at the end, so please stick around for that because we love to hear your feedback. So one last housekeeping thing before we move on to the content that I know you all are anxiously waiting for. We have some group agreements. We know talking about equity concepts and root causes and SDOH can be sensitive of nature, can make us uncomfortable. And so in order to help all of us navigate through that discomfort today and the learning today, we have some group agreements. And so stay open-minded without judgment. We're all here for learning, so take a risk, and we'll answer questions as honestly and accurately as we can when you have them. So make sure to either raise your hand and ask questions, come off mute, or submit your questions through the Menti, as Samantha just mentioned, anonymously. Take space and make space. We want to make room for everyone's voice. And so you may notice that we call on different folks and invite all of you to add to the conversation today. Expect and accept a lack of closure. One thing about equity work, it is iterative, it's cyclical. There is no end to this work. And so likely you might leave with more questions, and that's okay. Personal reflections shared here and stayed here. So if there's any personal stories, we'd like to keep those confidential between this group. But of course, anything that you learn, please feel free to share that broad and wide. Stay engaged as much as possible. I know that we all have competing priorities. And so, but you will get out of this training what you put into it. So as much as you want to talk and ask questions, we encourage that. Expect to experience discomfort. I already noted about that, so we'll go ahead and move on. To speak your truth. We all have different experiences, value experiences, and so we want to uplift those and also speak about our own truths only. All right, so I encourage using I statements in order to help us do that. What other group agreements should we add? If any? Can I just get a quick thumbs up or a reaction for folks that we are all bought in to these group agreements and that we are going to follow them together? Okay, I see some hearts, I see some thumbs up. Thank you all so much. Of course, if we need to add anything as we keep going along, we can add them. All right. I think now I'm going to pass it over to Lori to get us started with the content.
Thanks so much, Janice. So as we're kicking off, we think it's really important to ground ourselves in some definitions. And even though those definitions may be familiar with you, we want to make sure that we're just all on the same page with them. So we think of equity as both a process and an outcome. There are foundational pieces like this that ground our work, and espousing that equity is both that process and outcome are really important to us. So we've taken this page from Chicago's definition here, which comes from Chicago's Equity Statement of Principles. As an outcome, equity is fair and just access to opportunity and resources that provide everyone with the ability to thrive. It's really why we do our work. And as a process, equity is the way in which we do our work by prioritizing population groups who have the greatest needs. We use tools to understand and measure the benefits and burdens produced by systems and practices. And we engage those that are most impacted by inequities as experts through their own experience and as strategists in co-creating solutions and evaluators of success. So that's how we define equity as both a process and outcome. And we'll take a look here as we have described health equity as an outcome. It's when everyone has a fair and just opportunity to achieve optimal health. Health inequity then would be the opposite, in which certain groups or populations do not have the same opportunity as others to achieve optimal health due to systemic imbalances in power and systems of oppression. For example, redlining of some African American communities have unjustly zoned them to underfund school systems and built environments. Those are two very important social determinants of health that we know impact health outcomes. As a result, we see health disparities. So differences in health outcomes or healthcare access. The difference between health inequity and health equity, or health disparity rather, is that health disparity only describes the differences in health outcomes. It does not take into account the unequal structuring of life chances. So it's those life chances that really make this unique, this definition. So let's take a look now at community power and power building. We'll have spend quite a bit of time on this later in the workshop. So we're going to discuss the significant role community engagement plays in an equity approach. And you'll be kicking off your work with community engagement activities. To create sustainable community health improvements, it's important to build community power, which is the ability for communities who are most impacted by systemic inequities to grow an organized base of people to make decisions, create accountability, and towards health improvement and equity. So as you all are thinking about your strategies for your SPAN work, you all may also consider incorporating some community power building or strategies that will be used by communities most impacted by the structural inequities to increase their community power. Thank you. So next definition we want to take a look at is base building. And you may consider adopting some base building strategies to support community members in building connections with each other and investing in each other's leadership towards collectively developing solutions and implementation plans. So base building activities are the things that are really process oriented. They take some time. It's about relationship building. So we often think of this work as highly relational. It's a diverse set of strategies and methods to support community members, to be in relationship with one another, to spend that time, invest in each other's leadership and learning, share community identity shaped by similar experiences, and an understanding of the root causes of the conditions, using their collective analysis to create solutions and strategies to achieve those. So that's what base building really is. And next slide here. I want to take a look now. We're going to share two visuals, two frameworks that can be really helpful, excuse me, in understanding health equity. So now that we've really taken a look at some common language, we have that established. Let's take a look at two frameworks. The first one here that we're going to look at is the Bar-High Equity Framework, and this comes from the Bay Area Regional Inequities Initiative. You may have seen this. It's widely used as a health equity framework. And many times in public health, we focus, excuse me, we focus on programs and interventions that are targeted at the individual level, which you see over on the right. And we often call that downstream work. It's not that that's not necessary. It is necessary, and particularly when there are no services available, it's really important and necessary that we provide those. But we also want to discuss that health inequities exist because of the patterned imbalances of power and systems of oppression, which have often often created the conditions. Excuse me.
It's water.
Often have created the conditions in which poor health outcomes occur. So to truly advance equity, we need to be able to focus also on the upstream causes of those inequities, which you can see on the left side of the screen here. So we have social inequities. Those social inequities often are things: class, race, ethnicity, immigration status, gender, sexual orientation. Those, just having those characteristics and those social inequities can make you more apt to experience inequities. Institutional inequities, these are related to organizations, that they have a big impact on patients and individuals, community members' lives in one way or another. And so government agencies, corporations, hospitals, businesses, laws and regulations, nonprofit organizations, all those types of things. And then we also have living condition. And the living conditions are really the upstream categories that we're talking about. They're directly outside of the control of many people. And it's really thinking about the physical environment, which affects factors such as land use and transportation and housing and segregation, all of those things, economic and work environment, the social environment, and the service environment. So many different areas that impact people upstream. So we want to focus our efforts also on upstream, not only the downstream. Even if our strategies have are focused on downstream, we want to be thinking about how can we get to these underlying root causes, which are upstream. So the upstream factors affect behaviors such as smoking, poor nutrition, low physical activity, all those things that we're directly working on. Sorry, Janice, go ahead to that next slide. The next model you see here is designed by NACCHO, the National Association of County and City Health Officials, for the MAP, Mobilizing Action Through Planning and Partnerships 2.0 framework. So if you haven't heard, that is a framework that many people use for their community health assessment and community health improvement plan. It's recently been updated with centering health equity through all of the activities. So we really like this health equity action spectrum. It's similar to the Bar-High model. It shows how the root causes of inequities are related to individual behavior and outcomes, and supports the identification of action that public health practitioners can take along the spectrum to advance health equity. So we'll use this framework throughout the rest of the training, and refer to it occasionally as we start talking about this next model, which is also from NACCHO. And they have developed 7 guiding power practices that help understand how to develop and apply a power framework in your community work. So this is really equity in action as we think about it. So this is part of the health equity action spectrum and intended to be used alongside that. So those 7 guiding practices, we're going to walk through each of them in a little bit more detail. But the first is process, where we are just unpacking and trying to better understand power and privilege. The next is to form, make sure we're building and creating an environment and a container to do this type of work. And there are some very explicit skills to do that. Study, that we're learning about our community's histories, our organizational histories. Build, we're cultivating relationships with communities and partners. Share, we're practicing power sharing with partners and community internally and externally. And practice 6, we strategize and act and implement. So we're implementing, amplifying, and investing in community. Priorities and solutions. So understanding those and then addressing those. And then, of course, evolving is really about continuous quality improvement. We're reflecting on process, we're reflecting on the way that we do our work together, the results or the outcomes, the accountability and the sustainability, so we can continue to improve and strengthen our work. So this power framework that you see here advances our commitment to sharing power with communities who are most impacted by inequities. You'll also see that it helps to increase awareness and attention to the power dynamics within the public health system and beyond. It helps to increase understanding of community power building and why that's important to address health inequities. It helps to advance commitment to building relationships with old and new partners. So we really want you to stretch your mind today in thinking about new partners. Increase understanding of how to support local community organizers for power building. And finally, it provides a rationale for partner organizations to build capacity and implement actions to support community power building. So as I said, we're going to go through each of these practices, and I believe on the next screen here, Janice is going to take us through practice 1.
Yeah, thank you so much, Laurie. And I just wanted to remind folks that you all are able to raise your hand and ask questions, drop those in the chat, or you can use the Menti link from earlier to ask any anonymous questions that you might have as we go through all of this. All right, so I will kick us off to talk about practice number 1, the process. And so institutional decision-making is a major way that power operates. Think about who makes the decisions and who actually gets access to those decision makers. Who will receive the funding to do the work? There's a lot of power that comes from the answers to those questions. However, we rarely talk about it or name it openly. Government institutions have significant power over communities, but are not necessarily accountable to communities. So taking time to conduct a self-reflection and an organizational reflection may allow exploring of your organization's decision-making history, and that also might provide valuable insight into the context and opportunities for how you might be able to do things differently. These complex conversations may benefit from external experienced facilitators, because as you all are reflecting on historical decisions, we want to provide a opportunity for folks who are participating to think about that without having to worry about facilitating a meeting. If resources allow, hiring someone to help create that needed space to hold emotions and the complex feelings around exploring those historical decisions can also be helpful. It's important to keep in mind to approach this work with grace and patience for yourself and team, because anytime you're having a reflection about process, it really is a learning and a growing opportunity. And so we want to give you all an opportunity now to do some of that self-reflection, do an activity that we call the Power Flower activity. And so we're going to drop the Power Flower handout in the chat. And we'd like you to just take 1 to 2 minutes to individually reflect and mark the slices of that pie that apply to you along each dimension of the flower. So you're really doing an identity reflection here. Which of these slices describe your own identity? After 1 to 2 minutes of reflection, we're going to move into a 5-minute breakout group so that you can discuss the following questions. What came up for you as you reflected on your own individual identity? Were there parts of your identity that felt complicated to fit into this activity? So we'll go ahead and post these questions in the chat. I don't see the worksheet in the chat yet, but I know Samantha.
Sorry, I'm dropping it.
Yes. And the worksheet looks exactly like this wheel here, so feel free to take a look at that and make a note to yourself.
Are you able to see it in the chat?
No,
Okay. Sorry about that.
So sorry about that.
1 second. Let me try again.
and folks, as Ginny said, what you'll see in the chat is really just the same visual. So as long as you're taking a look at that right now and jotting down your identities based on this, that will be good enough. I think we should move on, Janice.
Yeah, absolutely. Samantha, if you can go ahead and open up the breakout room so folks can discuss what came up for them as they were looking at this wheel.
Yes, and it is in the chat now. My apologies. Opening up the rooms. Okay.
I'll go to one.
Okay, thanks. Samantha, if you can just stay here, I'm gonna go, Lori, I'm gonna go to rooms 5. Oh, she jumped. I'm just gonna start from the bottom.
Sounds good.
Sorry about that, Samantha.
No problem. It's my fault.
Samantha, I'll just hang out here with you.
Sounds good.
Thank you. All right. Do we have everyone back?
There's still 2 rooms, 3 rooms that are joining. They have about 16 seconds.
Got it.
Just when everybody starts getting going, we have to.
Yeah, I had to close it out.
It's just meant to give a taste.
Yes. All right. All right, so I hope that you all had a good opportunity to, like Lori said, just kind of scratch the surface of this conversation. We have a couple of questions that we'd like to open up for discussion. How have you noticed your personal identity showing up in your professional work? And feel free to come off mute and answer this if you feel comfortable. Anyone feel comfortable to share?
I could share.
Thank you.
Hi everyone, I'm Alex. So when I, kind of looking through this and just like my own personal identity, I feel it's very connective with the communities that I serve and also try to help amplify. So I feel like there's always like that connecting piece too that I bring, my own personal stories and experiences into that professional workspace. So then that way I could be able to connect more with like my community and in different workspaces. And I feel like that's also kind of building that trust between my work. And yeah, so that's pretty much like how I notice like my personal identity also helping me like in my professional work.
Yeah, thank you so much, Alex. Kenneth, I see your hand up.
Yeah, I think for me, like me being a African American male, I think professionally it gives me the opportunity to like represent my community. But the other side of that is there can sometimes be an assumed expectation of experience. So there's that.
Can you speak a little bit more on that? What does that mean?
Sure. So for example, like if things are going on in the Black community, like I can ask in order to like maybe like explain a person's motivation or explain like why certain things are happening. And certain things I'm like, I don't know. Like, like I don't know. I don't know why they would do like I wouldn't do that, but it's like so it's like that's that individual's experience. And just me being Black does not necessarily mean we have the same lived experience. Like we can have different family backgrounds, different religions, different economic status. So there's going to be a host of other things that can be put into Blackness that does not necessarily, in my opinion, fall into Blackness. That can be just a whole another set of circumstances.
Thank you so much, Kenneth, for sharing and diving deeper into your reflection there. The next question is, how does your personal power and privilege shape your understanding and lived experience of health inequities? Did anyone have a reflection there?
I'll speak to that in relation. This is Joanne. I keep turning off my camera because the light is so bright in certain areas. But as I look at my privilege in terms of I am an African-American woman, but my personal power comes from my love and strength in helping families breastfeed, because I know that that is very much something that's needed. We need to improve the inequities in that. And I can share my lived experience because people will say, well, Black women don't breastfeed. And I'll tell them the story of my mother breastfed. I saw my sisters breastfeed. Well, not all, many of my 100 nieces and nephews provided. So I share that with people to say that don't make an assumption because of what you've heard. Ask the person. And as I can share with people who don't know about breastfeeding, the risk of not breastfeeding. So I'm privileged in the sense that I am an IBLC, a Black lactation consultant, and there's not many. So that in itself is an inequity, and one of the probable reasons that more Black women aren't breastfeeding. We need that coordinate care. And I can understand when a person says, my mama told me not to breastfeed, or my boyfriend, and because I've heard it and I've witnessed it. So.
Yeah, thank you. Thank you so much, Joanne. I love how you lifted up about avoiding making assumptions and instead ask more questions. So that I love that. For the sake of time, I'm going to skip to the last question. Did any of you all get to think about how you might be able to center the lived experiences and expertise of people at the outer ring of marginalized identities? I know it was a short breakout, so you all might not have gotten there. Any thoughts? Okay. All right, no worries. There's plenty of time for the remainder of the training for you all to think about this and jot some notes down. So for now, we're going to wrap up this activity, and I'm going to pass it back over to Lori to talk about practice number 2. Oh, Lori, you're on mute.
Thank you. Practice 2 is form, and it's really about building the container to work together. This is a really critical step. It's things that you all are familiar with, things that you know, but sometimes when we're trying to save time, we skip these things, and they're so essential and important. So building a container for your work really means creating an environment that humanizes group process, and participants. So the focus is really on the participants and that environment they're in, and how we can create that environment that's really conducive to them, building trust and building relationship. Creating the container helps to prioritize relationships, build trust, and allows people to bring their whole selves to the work of advancing equity, which really leads to more meaningful connections and increased vulnerability during conflict resolution and other discussions. So having a strong facilitator to help create that container and to help keep that container a safe space, a shared vision, and a model for vulnerability and self-awareness is absolutely critical. So if this isn't a role for you, if you need to hire a facilitator when you have these types of discussions, I highly encourage you to think about that and do so and build that into a group budget, because that can really make or break how effective the discussions are. So some of the recommended activities for building a container are, identifying and really understanding who is this container for? How will it be used? Think about what that purpose is, and purpose is really going to drive what you need to do and how you need to set things up. So who's going to be the initial group, and how are they going to be on this journey together? Are there going to be other people joining, and what kind of orientation do they need to the discussion? Those types of things. So identify 1 or 2 skilled facilitators depending on the size of the group. And ideally make sure that as much as possible, they have some shared identities with participants so that there's that experience leading conversations about power, privilege, and oppression, or with experience in racial justice, maybe some experience in body work and movement or healing work. Those are all really helpful characteristics. Having people do introductions is important. We didn't have time in this training and weren't getting into great detail, but we did try to do some introductions to get you to start making some connections with each other. Have people introduce themselves with including their names, their pronouns, maybe their racial, ethnic, and cultural identity. And an icebreaker question that's really meaningful that helps people get to know each other and focus in on the content at hand. Definitely always use group agreements and review those before the conversations to help people understand what you share in terms of goals and normative behavior that you're establishing for that group. Make assumptions about the work explicit. So if there are assumptions, we don't want to leave it at that everybody knows what health equity means. So maybe we want to say health equity work is really about having deep, sustainable organizational transformation and cultural change using the head and the heart. And so we're going to be tapping into both the head and the heart. Maybe making those things very clear, making it very clear that people should be able to have the time to take care of themselves if emotions and things come up. So whatever those assumptions are, you really want to label those. And speaking of head and the heart, you can practice using tools like the window of tolerance, which is just been put in the chat, along with comfort stretch panic zones. Those are some great tools. Human Impact Partners is a great resource for a variety of tools, but really helps honor the piece of the effect that the effect that this can really have on individuals and on their emotions, and really that if people don't take the time to deal with that trauma and to feel that trauma, it can just continue to cause more damage. And so we want people to take care of themselves. So take a look at those 2 tools when you get a chance after today's training. And we're going to jump into practice 3 here. So practice 3 is study. And to address health inequities in your area, it's really important to understand how and why those inequities came to be. And I've worked in a lot of communities where people say, we're a homogenous community. We don't have a lot of racial diversity, so this doesn't apply. But you can see from the flower power activity, there are a lot of different identities that really make up a community, and we need to understand who our primary populations are and what those identities are, and the history of the land, the history of the community, and how experiences of injustice and oppression have impacted various people and caused harm, past harms. So you can always start this work by understanding your own personal history and how your family came to the community or the land that you live on or work in, and then consider engaging others to help really identify more information to understand the history of Indigenous people, Black communities, others in that community and how they came to be part of the community. Think about how national policies and practices shaped communities in your area, how maybe state or local policies, and just remember that not everyone's story is told on the internet or in books, and so we really need those auditory storytelling and those oral histories to better understand what's happened in the past. So that's practice 3. And practice 4 is building. It's really building and engaging the community. So meaningful community engagement improves both process and outcomes. It's an opportunity to assess current partners and to challenge yourself to expand and work with new partners. And I know even in some areas, we think, oh my gosh, we don't have that many people or that many partners. We're working with everyone. But if you really stop and look at all those identities and really question, are we working with everyone? You might find that there are new partners that you can tap into. So how have you worked with partners in the past? Who have you worked with in the past? Which communities have you successfully and or unsuccessfully engaged? How can we support communities that have been identified related to the priorities, who have been most impacted by the priorities that you have? So there are really 4 tips that I'd like to share with you for building relationships. And that is go broad and deep. So you really want to build authentic, trusting relationships with groups of community members and inform all communities about the opportunities and programs rather than an either or approach. You want to do both. You want to show up, you want to be present, you want to be at all those events that may not be important to you, but are important to people with different identities within your community. You want to be consistent and helpful and just be present and be there. Follow through on the commitments that you make to community partners and members, and show up to learn, not just to be seen or to share something or to share information that you have, but to learn from those partners and those community members. And really being real, being as authentic as you can, being honest about where your department or your organization is at in your learning and your growth process, what your department is ready to support, where you hope to grow into, what's not possible. Just don't promise what you can't deliver. It's often challenging. And then finally, being patient. Real partnerships take time, and reaching out long before your grant application deadline or a big hearing where you need people to show up and advocate for a particular policy, really building those relationships ahead of time. And you're continuing to move at the speed of trust, which we know can really be much slower than we'd like it to be. So finally, I'd like to introduce to you the spectrum of community engagement. Some of you have probably seen this. I know Sarah showed this in the SPAN kickoff meeting. This is a visual tool that can really help us identify opportunities to deepen community engagement by moving towards power sharing practices. Now, there's perfectly acceptable times where we need to be at more of the inform or consult phase, and other times where it's way more appropriate to be at the power sharing and defer to stage. So power sharing is the intentional effort to distribute decision-making power to the community. So we discussed this earlier. That means recognizing that community members have valuable knowledge and expertise about their own experiences, and we trust them to be able to make decisions based on that experience. So I want to show you another picture of the spectrum of community engagement to ownership. And Samantha, thank you for putting that in the chat. You can download a copy that's bigger and that you can keep, but this has more information. I think this full tool is helpful to see the action steps, which steps take longer administratively. So it's really, really helpful to think about this. I also want you to use this for our next activity to think about, where is your organization most comfortable? Where do you individually just take a look at that spectrum of community engagement and identify where your organization typically operates. So most of the time, your organization operates here. Where on that spectrum does your organization typically operate? Where are they most comfortable operating? And does it vary based on projects? So how is it different based on different initiatives or projects? So I'm going to ask you to just discuss that in small groups really quickly. Take a look at where you're at, where you're most comfortable at, and how that varies based on projects. So Samantha, do you want to split us off?
Okay.
Thank you. This time you're, some of you might be in groups with people you work with more because you'll be answering based on the same community. Some of you will be in mixed groups though.
I'm gonna jump to group 5 first and work my way up.
I'll go the opposite way.
All right, welcome back. We got about 30 more seconds before everyone else joins us.
Hope we didn't cut too many of you off mid-sentence. Is everybody back now, Janice?
Yes.
Great. Well, thank you. It was really interesting starting to hear some of the group discussion. And I just want, before we move on, to ask, what are some of the changes that need to be made within your organizations to advance along the spectrum? I know some of you are already comfortably navigating across the spectrum, but others may not be doing as much. So what are some of the types of changes that need to be made?
I don't know if it's changes per se, but if you be mindful of capacity, that was brought up in our group. And then also timing, right? If it's a grant or funded project and there's a quick turn, it's harder to incorporate all of those components while we would ideally like them. So.
Yes, great points. And we're constantly advocating with funders for how much time this work takes. But something else that you all discussed in terms of how you can move along that spectrum and advance the work that you're doing to more of a defer to and power sharing.
Well, I'll speak on behalf of the group I'm was in. we're a health department, and so a lot of our grants are really tailored around community engagement. And so we did discuss that we perceive ourselves as being taken that way from the community, but we just never are really sure. But we do a lot of, you know, evaluations and focus groups, so we do get the feedback. So we feel like we're doing pretty well, but we just don't want to, you know, get too comfortable in that and think that we can't improve.
Yeah, thank you for that. I think a lot of us feel like we're good collaborators and we engage the community and ask them for their input, and we use that information to make decisions. But when it comes time to really turn things completely over to community and put them in the decision-making role, sometimes that's hard. And it can really be hard for governmental agencies like health departments where you have authority over certain things as well. And so that was why the question was, does it vary from the type of project you're doing? Because some things are that you know, can't completely turn your emergency preparedness over to maybe a community when you have a responsibility to lead that work.
Charlotte,
Anyone
yeah,
else? Go
Charlotte
ahead.
has.
I don't know how to necessarily put this other than to say it bluntly, like give us the money and leave us alone. And the reason I say that is because I provide TA to SPAN members. When you have so many regulations on funding and then the funding is not sufficient, don't tell me I have a seat at the decision-making table when I really don't. I heard Miss Natalie, and I'm sorry if I didn't get your pronouns correctly. I heard Natalie speak about like, oh, you know, we have to do all these evaluations, we have to do all these surveys and things of that nature. And are we essentially being equitable to our community? So are you providing stipends for surveys? Are we providing stipends for evaluations? But then at the end of the day, are we providing our partners with enough funding and time? Because I heard somebody else speak about time to make sure that they have capacity building and it's sustainable. Don't give me $2,000 for 3 years and expect me to come to you with a big plan that's going to support my community. But that's an outsider's view. I can say it because I'm not an organization. You know, I understand my reasoning for being in the room though.
Thank you, Charlotte. Those are really, really great points and very true. And it seems like more and more those are the challenges that even federal funders do want us to use a health equity approach and really engage community in all these ways. But the you know, the timelines of grants and the way they're structured hasn't been changing along with those expectations. So we have to continue to advocate for that and communicate with our funders. Anybody else before we move on? Okay, got one more slide here that I wanted to share, some tips for community engagement. So when you're thinking about and you're starting your community engagement, identifying local grassroots and community organizing organizations you want to connect with is just one of the very first steps. And you'll see in some of the assessment work that Sarah's going to introduce to you, there's some resources from Engaging for Equity worksheets that we like to use that really helps you push the boundaries of thinking beyond your usual partners or usual suspects, we often say, and learn about them, learn what's important to them and how you can connect with what's important to your organization, and you can align shared values. You can talk about the strengths and the values that each of you bring to the table. Being flexible and persistent in communication. Not everybody's sitting at a computer all day. They may not be getting emails. You may have to go to events where you're going to see them at. You may have to call them on the phone, you know, it's different strategies. You might have to text them, right? There's all different ways. Reach out through social media and connect with them. But there's different ways other than just emailing and doing a cold call that way. What I like to do the most is have someone who does know them do the personal introduction and take me along, and that's usually a great way to meet a new partner. Intentionally pursue activities together that build and deepen trust. What's something else that's not maybe your primary priority that you could work on with them, or just something small you could do to help them advance something else so they can see how you two or multiple people could work together and how that might work? Start with small, concrete collaborations, something that you can work on that's really time-oriented and smaller scale to build that trust and relationship. Always be thinking about how you can build these new partnerships. Somebody always used to say to me, you know, you can never have too many friends. You can never have too many partners. Same thing. Mobilize your resources, however you can share data, share evidence, share results, share things that will help advance their work. And in future years, build on the work to collaborate with an organization on power analysis together. Engage them in really looking at where the power lies in the community and how you can work together to build community power. You can help understand the structural reforms that will be needed for this type of power sharing and how you can move along the spectrum of community engagement. So that's really what we wanted to share through steps or practices 4. And before Janice goes through 5, 6, and 7, I wanted to pause and see if there are any questions or comments, experiences that came up for you that you wanted to share, or if anyone had submitted any anonymous questions, Samantha, that we can answer. So any questions before we move to the next practice? No anonymous questions? You all don't seem too shy, so if you have any, feel free to pop them in the chat. Go back to that Menti, or just unmute yourself and ask a question. Okay, Janice, I'll pass it back to you to take us through 5, 6, and 7 and close us out.
Okay, awesome. Thank you so much, Laurie. And we really do welcome any questions or comments that you all have, so don't be shy. So explore practice number 5 is practice power sharing internally and externally. And Charlotte, I think your comments were so timely because we are going to talk a little bit about some of those alternative things that health departments can do when they may have conflicting priorities. So as we've been talking throughout the training, a key step in addressing power imbalances is acknowledging the existing power that institutions have over communities and then working to transform the relationships of power. So as those of you who are from a health department, you might find it difficult to engage directly in community power building due to conflicts with political entities. You all have your own obligations that kind of extend beyond the community level. However, health departments and such can share institutional, relational, and positional power with the community members by directing funds, as Charlotte mentioned, to community-based organizations and other grassroots organizations, or leveraging the power that they have and their networks to be more inclusive and support community-led priorities. Some other considerations are including changing meeting culture and meeting norms and building community-based decision-making bodies. And I know that that is a common practice of developing a community advisory board or some other entity where folks can practice co-led or co-design governance and get decisions made in that setting. One note that I would like to talk about, because we've been talking a lot about community engagement, we've been talking a lot about community power building, and so sometimes incorrectly, those are interchangeable, they're used interchangeably, but just want to specify that community engagement that Laurie spent time talking to us about typically refers to informing, consulting, or involving community members in institution-led processes. Whereas power sharing really refers to involving a person or an organization willing to give over the power to others with less power to create a more equitable decision-making process, right? So when we talk about power building, it is voluntarily giving over the power to the community. And so we begin to see community power as we use community engagement strategies that ultimately end with the transfer of ownership and power to communities, which is on the right-hand side of the spectrum that Lori mentioned earlier. What questions do y'all have about the difference between those two and opportunities to share power, even when you feel like you can't give it over? All right, so I want to share some more specific examples about transforming meeting and organizational culture, because this might be where you have the most power to leverage right away. And so shifting meeting culture and how groups come together to make decisions can lead to deeper engagement and more trust with communities. Revisit your community agreements and how you build your container as a reminder for expectations for how your partners, how your community members show up, and how they work together. And Lori talked about some of those earlier. Something else to think about is how you and your partners can move away from dominant culture practices and into practices that help folks work through conflict and create space for people to move through any feelings of discomfort. Because as we talked about at the beginning of this training, talking about equity, talking about root causes and systems of power and oppression can get really uncomfortable. And folks oftentimes are vulnerable when they're sharing their lived experiences. And so how can you again, create a space where people can bring their authentic selves and move away from those dominant culture meeting practices? And so again, how can you create a culture of appreciation and continuous learning versus a culture of perfectionism, right? How can you think about ways to measure processes instead of only focusing on outcomes or the end goal? How can you role play and discuss how to handle conflict instead of fearing conflict and avoiding very important discussions because you don't want to have a disagreement? How can you work with funders and partners to understand that equity work takes time? It takes time to build trust. It takes time to change policy instead of focusing on what we can urgently accomplish and rushing through steps and missing those opportunities to really build that relationship and build trust. So one example that I want to take a moment to highlight that we worked with through our Alliance for Health Equity, one of our community groups uses the 5 to 5 voting method. And so this is just one example of how communities can navigate conflict in a way that allows for all voices to be heard. And it's likely that in a consensus building process or in a decision-making process that everyone won't be able to agree on everything. That's normal. Again, we're all human and we all have different experiences that bring us to decision points. But doing a temperature check and identifying what people can live with is a great way to build trust and consensus. And so something to keep in mind, if this is a method that you are going to use to transform your meeting culture, meeting norms, is to make sure that your rankings are clearly identified, right? I know I've taken so many Likert type surveys where I was just like, okay, is one high or is one low? So engaging your community and collaborative to make sure that there's a shared definition of what each ranking means when they are using the voting. And then also keeping in mind that this method or a method like this does not only have to be used to make a final decision. Consensus building is an iterative process. And so figuring out how to navigate conflict from the beginning to the end is important. And this tool can be used for that as well. All right, I see some folks like the hand ranking, so that's awesome. All right, we're going to go ahead and move right into practice 6, which is strategize and act. All right, so identifying how to prioritize and implement activities that will have meaningful impact on communities experiencing inequities is a critical step in the POWER framework. It's important to be strategic with utilizing your resources, your partners, and your communications. As multiple of you have voiced, time is limited, money is limited, partners might be also limited. And so how can you leverage those in the most impactful way? So some steps to help you think about how to strategize all your resources and use all your resources effectively is to do an internal power map of your organization, to identify who are your champions, who are the internal and external folks that are going to be influencing the strategies or the policies that you're trying to change or implement. Who are the potential targets of change? Who are those policymakers that might be on the fence that you can sway in your direction, right? Who are the decision makers, and who can you organize within an institution, and how can you build a network of champions to advocate for on your behalf? The next step is to apply and enforce. So after you implement the change, pay attention to the application and the enforcement of the existing laws or new laws, policies, and practices. Oftentimes during the application or the enforcement of laws and policies, unforeseen and equitable consequences could also be enforced. And so doing that regular evaluation is going to help make sure that the communities who are most impacted aren't suffering from unintended consequences. The next step is to invest. And again, I think we've talked a lot about this, but identify sustainable resources and funds, committing resources from your own health department or government agencies to support community power building, and thinking about how you can remove those barriers to access the funding. This can be in the structure of your grant writing and the requirements needed to earn the grant. All of those things are within your power to change the structure if you're a funder. And then last but certainly not least, amplify. So reflect on the supporting narratives you want to lift up in your messaging and outreach materials. This is very important when you're trying to shift a narrative, right? Oftentimes we hear a narrative about marginalized groups that aren't true or that are only based on one experience. So taking time to think about who really owns the narrative and how you can lift up that voice in your programming to get your message across is an important part of doing equity work. What type of messaging would help reaffirm your team's shared values and also affirm the importance of health and well-being? Thinking carefully about those messages, thinking about making sure that the messages are in a way that the community that resonates with the community, and that is in a language that the community can understand is all part of that process. All right. And then last but certainly not least, we have practice number 7, which is evolve. And this is really about continuous quality improvement. How do we evaluate our progress towards achieving or advancing equity? To continue to cultivate a resilient community power ecosystem for health, community organizations and health departments need to maintain relationships built on trust and accountability. So like, as Lori mentioned, it's really important to think about how are you building relationships and maintaining that trust outside of a grant cycle, outside of a community health assessment cycle, right? You want to make sure that those partnerships are steady and solid, even when you're not necessarily needing them in that moment. Developing a continuous quality improvement involves creating a continuous feedback loop to ensure that the work is helping build towards the identified goal and a desired outcome. So this really is an opportunity to go back and re-engage folks with lived experience, re-engage BIPOC communities, Black, Indigenous, and people of color, re-engage those who are LGBTQ or gender diverse or neurodiverse, right? And asking them, like, are these processes actually achieving what we want? Where can what can we start? What can we stop? What might we need to innovate in order to keep this work moving forward? In this example that you see on the slide, making sure that you have a SMART objective that centers a population impacted by inequities can help keep you on track and keep your equity focus centered. So for example, maybe your goal is to achieve a 20% increase from baseline in the number of Black women who receive breastfeeding counseling after birth. That is made up and may not be a best practice, but this is just an example. So follow me for a moment, right? So because you're measuring something specific about Black women who we know commonly experience in health inequities when it comes to giving birth, that is going to definitely help keep you on track towards a progress on advancing equity. And so what questions do you all have about establishing a continuous quality improvement plan? Laurie, okay, that's a great question. What is missing from this SMART objective?
It's specific, measurable, achievable, relevant, time bound. We're missing time bound, right?
Yeah.
Thanks, Charlotte.
Thank you. All right. And so as we think about continuous quality improvement and continuing the feedback loop, these are some questions that you and your team might want to consider. Have we actually shared power? In what ways have we shared that power? Have we actually shifted power? So again, do we have community decision-making bodies actually driving the work and making decisions? Are the goals and measures that we set realistic? Do funding and staffing exist for successful implementation? And how can we hold ourselves accountable to potential missteps, mistakes, or harm when working with communities experiencing health inequities? So I want to pause here and see, what concerns still remain about power sharing, giving your own positionality within the community. So I know that there's folks from health departments and other organizations. What concerns do you still have about power sharing? I have another question. Up until now, what barriers have you faced when you have attempted to power share? Any thoughts? Kenneth, thank you.
Well, I think there can be some pushback from one's own organization sometimes. I think they're like, as an organization that like focuses on advocacy, we pride ourselves on like reaching out to the community and representing the community. But when it comes to time to like turning over that power, it's like it can be scared. So it's like you can be scared to the point where you're just trying to like, okay, yeah, we're going to invite the community to this meeting to speak to these like politicians or something like that. But then it's like, oh, do we need to have a prep meeting first? Because like, what are they going to say? Like, are they really going to like toe the line of the agenda that we already have set? So I think it's something that we have to be careful of, is like when we are power sharing, we have to be okay with the people that we are representing not necessarily being all the way in line with us, and they may go in a different direction, but that is their choice and their power to do so.
Yeah, thank you, Kenneth. So quick quiz. We might have mentioned this, but does anyone have any idea of how to alleviate that fear of maybe a community member or a community organization going off script or going off the agenda? What is something that you could do to mitigate that? Any ideas? There's no right or wrong answers either. This is just for us learning.
Hi, I have a thought about this. So recently I kind of did a talk about nutrition inequities for early childhood, a little bit of the webinar. And when I was looking at the data and statistics, I saw the breastfeeding prevalence, like again, circling back to that topic, prevalence. And then I saw that Asian and Hispanic mothers have like a higher prevalence of breastfeeding initiation. So, and I was thinking about it, and then just made a comment about that okay, they might have a good prevalence of breastfeeding, however, they might have feeling other issues that is happening. And as counselors or practitioners, we cannot stop ourselves just looking at that number. Oh, they are doing good by themselves, so we don't have to worry about them anymore. So because there is another research findings that came across that Hispanic mothers are like finding other difficulties in their own households, implementing some of the evidence-based feeding practices because their mother-in-law or husband may not be approving those kind of like practices. So there, even if we kind of assume that some particular like racial or ethnic group are doing great, we might not, or we should not stop our help or support for them, or probably like consistently focus on each of those groups. So what I'm trying to say is not only inequity but also focusing on universalism. So everyone should have that 100% like support from us, and there would be like some of the groups would need more support from us versus the other may need less, but probably holding our assumptions back and then just like providing support for everyone is important. That's what
Yeah.
I felt.
Yeah, absolutely. Thank you so much for lifting that up. And one other thought I had while you were saying that is going back to the health equity action spectrum, right? I think a lot of times we we gather and we get in front of politicians to think that we're talking about one issue without really thinking about a root cause or doing a root cause analysis. And sometimes that sparks up feelings for folks to say something that might seem like it's off the agenda, but it really is a root cause that they're talking about. And so how can we make sure that we're thinking about a root cause analysis before, to make sure that the community is actually addressing a need that they have, right? The other thought that I had was that I think another important step is co-creation, right? So if you're working with your collaborative or your community decision-making body to co-create the agenda, then you're creating a buy-in about what you all will be discussing when it's time to get in front of the policymaker or whoever you're doing the presentation to. And everybody goes into that meeting on the same page because everybody worked together to put it together, right? Yeah. All right. Any other thoughts or questions that you all have about steps 5, 6, or 7? All right.
Hey, Janice, I just want to
Yes.
say, don't forget or don't skip reflection. A lot of people are like, I don't need that. And yeah, okay. Don't skip reflection. I don't care if it get down to a minute and you say like a one-word reflection. If you hear confused, frustrated, uncertain, then okay, you can address that in our next steps. But if you leave that room without reflection, you don't know.
Right.
So
Absolutely. Absolutely, Charlotte. Thank you. What other thoughts are floating out there? All right. All right, so I think we are going to wrap up this portion of the training. We'd like to leave you with is as we close today's training, we like to emphasize and remind that this work by no means is linear. Organizations and groups, your teams, your partners, you may find yourselves revisiting these steps or working on more than one of these steps at the same time during any stage of the planning and implementation process. Changing systems, advancing equity, it really does require deep partner, relational, and organizational work with equity as the focus. That assumption needs to be present at all times if your goals and objectives are going to be centered around equity. Because power imbalances are steeped, very deeply steeped in institutions and in our culture, it really does take practice to do this work. It takes a lot of patience to do this work. And last but certainly not least, it takes a lot of time. And so again, extending that grace to yourselves and to your partners, and to community is going to be very important as you embark on your equity journey. And so in training wrap up, you want to take some time for reflection and ask you all, what opportunities are there for you to implement one or more of today's concepts? Feel free to drop your answer in the chat or unmute. What opportunities are there for you to implement one or more of today's concepts? Beth, thank you so much. Glad that you find that these tools that we've shared today are effective. Maybe can we hear for someone that we haven't heard from today? All right, Sarah's lifting up, always building in time for reflection. Upcoming meeting with team members and partner sites, plan to use it. Awesome. I definitely plan to share the Power Flower with my organization. Awesome. What else? Share with my staff at the agency and senior center directors. Awesome. Do any of you have any examples from your own experiences of when you shared power in an organization or where you gave power or shifted power to a community that you like to lift up?
If nobody else owns, I can give you an example. This is Joanne. So I'm a IBCLC and I've loved teaching breastfeeding and helping with breastfeeding. And since I retired, I don't do home visits as much. So my way of not giving, but encouraging and supporting the power with them is I'm working with a group of doulas to help their doulas become IBCLCs and doulas become empowered to teach the classes themselves so that they don't need me, but I'm there as a resource. So I could easily say, nah, I want to keep teaching the class. But it ain't about me. If I can get them to do it, and then that way there's more people in the community who will continue to do it.
Yeah. Yeah, Joy, I like that ending where you're thinking about sustainability, right? And give community the tools to keep programs going even after you're not there. It's very important. What is something that you all are going to start, continue, or stop or reframe as a result of this training? Start, stop, continue. Practicing some CQI. Anything coming to mind? Great. Well, I'll tell you what, I'm going to put that last question in the chat so that you all can continue to think about it. And feel free to respond to it in the chat. I will 100% validate any responses that are there. But for now, I want to end with enough time to share resources and for you all to hear what to expect during the project. So everyone will get the slides in the recording and also the list of resources that we've shared during today's training. So please feel free to take a look at that and browse through all of these wonderful resources that we've compiled for you. I know that we're in discussion because having an equity training for 2 hours is not enough. And so we'll be in contact with you all to think about how we can continue providing this type of support as you all get ready to start your strategy work. And then last but certainly not least, contact information. For those of you who might want TA or additional support specifically related to equity work, get in contact with Sarah Flores for those requests, and she will pass them along to the most appropriate person. And then, of course, we have our training evaluation. And so we really do appreciate your feedback. So if you could take a moment to scan this QR code with your phone or go to www.surveymonkey.com and these additional letters to give us feedback and let us know what you thought about the training. Thank you, Becky. I see your last reflection about the power circle is to remind me that everyone is a different place. Awesome. Okay. Thank you all so much. I just want to leave this up for like 30 more seconds so that you all can get that evaluation code. Thank you, Samantha. Just dropped the link in the chat as well.
And you want to hang on after that, at least the SPAN priority regions and the SPAN TA providers, because we're going to go over some next steps for that work. So, and I see you've taken us that. Thank you, Janice. Excellent
Absolutely.
training.
Thank you.
So, most especially for our SPAN priority regions, the SPAN TA providers, but of course, SPAN is the backbone of IAPO. So it's great for everyone to know about this because it will, and when we do our state level discussions, that will integrate more of our IAPO membership as well. So as part of a next step, now that this training has happened, it's really the kickoff to the next 6 months of the SPAN year 1 work. And as you know, the thrust of that work is a series of input gathering and assessment activities to really understand what is going on in the regions and in our state with the 4 SPAN strategies, so that we can move ahead with planning for the priorities and activities for the rest of the 5-year SPAN period. So as you embark on that work, we have a couple of tools to help spur that thinking on health equity and really how to operationalize it in your work ahead, your plans and priorities. So these tools will be the next step to actually carry out that work. So it's 2 things. The first, we'll be sending the SPAN priority regions after the training, and it's a regional equity assessment tool, a Word document that you'll fill out. The purpose of it is really to do some of that overall thinking and framing around your region, specifically looking at your partnerships and exploring your region using different data sets to really get a better understanding of where are you at with your partnerships, especially with that health equity focus, and how would you like to grow, expand, deepen, nurture, establish partnerships to move toward really centering that community experience and voice in your work and making sure the needs of the SPAN priority populations are being addressed by your SPAN work. So looking at partnerships and then looking at the region, where are the SPAN priority populations within your regions to guide those priorities and planning? So the focus you'll see, and just keep it at the forefront of your mind, is the SPAN priority population. So communities of color, low income populations, and rural populations. And just a little guidance on the tool. So you'll see it, but it's meant to be done as a team, the SPAN region team doing this together. So you're really getting everyone's thoughts and engagement in this. It's a beginning of a conversation. As has been emphasized throughout this training, this is an iterative process. It takes place over time. Please consider this a living document. And it's really to spur that initial thinking. And it's not an intensive planning process. You're really doing some thought in these 2 areas around partnerships and SPAN priority populations. So the goal is to complete a first draft of this by the end of June. because then you'll really be kicking more into your specific input gathering activities, and this will help with that focus. And we have the SPAN TA providers on the call who will be helping you in certain aspects of your year one work, and the IPHI team is here as well to support you. And we also have available to us through CDC, that's funding this entire project, some TA providers that have expertise in health equity driven work. So we'll send it post-training. I'm going to turn it to Trevor because he's going to show you the map tool that you'll be using as part of this.
Hello, everybody. My name's Trevor Johnson. I am the Nutrition Initiatives Program Manager, if we haven't met yet. And I'm going to do a brief overview of the Spark Maps tool here. And before I share my screen with you, I just want to let you know that this is a tool of the Center for Applied Research and Engagement System, CARES, out of the University of Missouri Extension. And it pulls together 111 data sources and 347 report indicators into a data visualization tool. And what I've done is compile the indicators that we want you to look at for your regional assessments. And I'm going to take you through a brief illustration of that tool. So I'm now going to share my screen. All right, and when you click on the Spark Map link, this is what you'll be shown at the login when you just go into Spark Maps. And in order to save your assessments, I want to show you how to do the registration process. So if you can see my cursor here, it's over the login registration button. And after clicking that, you're going to be prompted to log in here. And it's very simple, and this is free. But what this will allow you to do is save the map that we've generated for you. And when you click the link that's in the document Sarah referenced, what you'll pull up is this map pre-populated with all the different links. And while this is showing a state level, of course, you will be zooming in to the areas of particular interest to you. And what we're going to do here is just look at a couple of different priority population and a health indicator data set. And I'm going to show you how to work with that. And for what I'm going to select, I'm going to work with this depression map. And we always want to get information from as small of a geography as possible. And this ZCTA means zip code tract. And I am also going to pull from a population with any disability. So I'm going to pull down here. And click on my population with any disability. And what you'll see is that my data sets are really far apart. So I'm just clicking and holding and pulling it up. So it's right next to my other data set. And again, we want to go back to the smallest level that we can. To illustrate this for the population with any disability, I'm going to click on an area that has any particular area, and it's going to give me that information, percentage 23.7%. And you'll notice the color key over here will relate to everything. And the pattern that you'll follow, that this will follow, is always light to dark. And that'll come up again in our looking at different indicators. So in looking at these indicators, what we can do is use the slider to go in between and see where there are differences. For this particular, for two data sets, let's call this the Fortean slide. We're going to set one to 40%, and then we're going to slide the other one. So what we'll be able to see is where the darkest areas overlap. And that's important because those are the most burdened places. So setting it to 0% transparency, we see this ring around Carbondale or to the northeast of Carbondale. And by doing our Fortean slide, we can see that there's a significant portion of that that also overlaps with the highest burden of depression in young adults. So what will happen with your strategy assessment is that you will add different data sets per the strategy. And what I'm going to do now is show you what it looks like to add one of those data sets. You'll notice I set these to 100% transparency so we can see the new data set, and you will always be prompted with this search. What we're going to suggest that you do is engage with the copy and paste method. We've given you all of the indicators, strategy specific indicators in bold, but you can also browse by topic and browse by source. If you know a very specific indicator and who published it, you can also get that here. But I'm just going to paste in search. It's going to come up with one, and make sure you just check the indicator and then add to map. So you'll see it populated and it added pretty much in the center of our data set. So I'm going to pull it up so we can see it between the others. And I'm adding a food indicator here because I'm a food guy. And what I added is population with limited access to food and no vehicle. And if you're looking at 3 data sets as opposed to the 40-in slide, we're going to do the 30-in slide. So we're going to set our 2 sets that we're looking at to 30. And what you're looking at now, I'm going to get this one 100% transparent. What you're looking at now, the darkest places are actually the overlap between these 2 data sets. At 30%, you can see these darker areas are all highlighted. And now with this 3rd data set, you can now slide it and see where those overlaps are with the darkest color coming through in the 3rd. So you can see there's still some area overlapping in here. And after you add all the relevant data sets, you can save this map. And while this will prompt you to log in, you can add your name to it, add a description, and it will save it to your location after you have made a login. Just to let you know that there is a support glossary in Spark Maps to answer your questions, but also please feel free to set up a 30-minute overview session with me, and you can see my email there on the bottom of the slide. But also, I believe we've already exchanged many emails, but please feel free to reach out and I'll go deeper into this tool. But I promise that this is easier than it looks. And forgive me for bypassing the quote here at the beginning. I want to uplift all this conversation about equity. And sometimes when we talk about data, it feels antithetical to equity. And to let you know that the map is not the territory. This goes along with the individual interviews or site-specific interviews, interviews with eaters or users that will make this fully rich map of how to move forward in the SPAN process. So just want to go back to the beginning there. All right, I believe I've taken up all my time.
Thanks so much, Trevor. And just a coming attraction, in a couple of weeks, the next step after the regional equity assessment is we're going to send you a set of strategy-specific assessment tools that you will then use throughout the year. You'll do that general framing through the regional equity assessment at the top through June. And then you'll be able to move on with these simple strategy assessments tools to further dig into each strategy area, the 4 of them, and do more of that planning and prioritization. So informing your planning. So you'll get more, we'll restate this when we send it. It will be in a couple weeks. We wanted you to be able to focus on the regional piece first, but it'll be a similar template with little variations on the strategy. You'll be working on it throughout the year, living document, iterative process, a place to just really gather key information and thoughts, not an intensive planning process. And you will have support from the IPHI team and those TA providers. So more to come on that. Right now it's to focus on the regional. I now know we're over time, so maybe I'll kick it to CCCD to close us out.
Thank you all again for your time and your engagement. And I'm gonna just try to copy and paste the survey link one more time, but if not, we'll follow up with all the resources and give you another opportunity to complete the evaluation. Have a wonderful day. Thank you all so much. Bye-bye. Take care. Be well.
Thank you. Have a great day, everybody. Enjoy the Chicago weather. If you're here, it's beautiful.
Thank you.
Thank you.